Hi, and the shoulder, the shoulder and the scapular region. The surface landmarks. The spine of the scapula, the greater tubercle, the lateral epicondyle, head of the radius, medial epicondyle, and the inferior angle. The surface landmarks are very important. Even landmarks are very important for me to move around, and keep in remembrance. Even 1,000 times remembering a landmark, still I fail to go to medical college every day, such that I forgot my presence. And we have the muscles of the scapular region. So the deltoid, clavicle, acromion, the spine of the scapula, and the deltoid tuberosity and nerve supply, the axillary nerve, and we having the structure. It's a multipennate muscle. So the attachment of muscles of scapular region except deltoid, nerve supply and action of muscles of scapular region except deltoid. So like four septa of origin, and the fibers converge onto three septa of insertion, which are attached to the deltoid tuberosity. And um, then we have actions. The acromion fibers are powerful abductors from 15 to 90 degree. The anterior fibers are flexors and medial rotators, and posterior fibers are extensors and lateral rotators of the arm. Structures under cover of deltoid are bones and muscles. Uh, so then there are insertions of, and the origin and insertion of the deltoid muscle. So there is a spine of the scapula, acromion, clavicle. So this is something like a heart or a leaf-shaped one, along with the veins inside. So again we have the intermuscular septum, the deltoid tuberosity, intermuscular septum of origin, of insertion and of the origin. Then we have the anterior fibers and the posterior fibers. So muscles of insertion are given. Pectoralis minor on the coracoid process, supraspinatus, infraspinatus, and teres minor on the greater tubercle of the humerus, and we have subscapularis on the lesser tubercle. Then we are having pectoralis major, teres major, and latissimus dorsi on the intertubercular sulcus. Then we are having coracobrachialis and the short head of biceps from the coracoid process. Then we are having supraglenoid tubercle from the long head of biceps, and the triceps from infraglenoid tubercle, then the lateral head of triceps from the upper end of humerus. So origin and insertion of supraspinatus, infraspinatus, and teres minor are given in a diagram. So this something represents the nose, larger nose, and the nuchal cavity, and of actually the anatomy of the nose actually, but as a larger bone. Usually in the Great Barrier Reef, these larger structures are found. A big ear, a big nose, a big eye, and all of the things. So there is supraspinatus and teres minor, infraspinatus, insertion into the humerus. So this looks something like a dog bone also. And then we have the subscapularis muscle. So the lower border of muscle, origin from costal surface of scapula, multipennata. it's given an insertion into lesser tubercle of the humerus. Um, so the muscle is given in rays, and so this is something like fall of the bone, and so this is a multi-pennate muscle, and and we have different diagrams in the next page. So usually in page 78 of the upper limb, and horizontal section of deltoid region, showing arrangement of muscle in and around the bicipital groove. So we have pectoralis major, coracobrachialis and short head of biceps, latissimus dorsi, teres major, subscapularis and scapula, infraspinatus and the humerus, and tendon of long head of biceps and the deltoid. So we have the vessels given, anterior circumflex humeral and posterior. So the nerve is the axillary nerve. So then we have another diagram, that is the horizontal section of the deltoid region, showing the nerves and vessels around the surgical neck of the humerus. So upper lateral cutaneous nerve of arm, posterior circumflex humeral artery and vein, axillary nerve and its anterior and posterior divisions, axillary vein and artery, anterior circumflex humeral artery and vein, and we are having the deltoid. This is one more structure. So the previous structure is like a duck. So duck bill was one such one, and so this is something like a duck or an egg containing the embryo of a duck. So then the next one consists of vein and an artery. So this is something like a chicken egg. Consisting of an axillary vein and an artery. Usually the um, like the when its embryo is hatching, fully developed and hatching out, it shows the vein and a prominent vein and an artery. So from that we could find about the chicken egg. And so then we have this joints and the ligaments. We are having muscular tendinous cuff and coracoacromial ligament. So the bursae, and we are having subacromial or subdeltoid bursae. So next we have some colorful embryology, and the attachments usually, which resembles an development also. So muscular tendinous cuff of a shoulder. These regions are always burning regions which keep on developing and forming, such that even if there is an injury, there is a formation and a cover, and resembling the same of the shape, but of a different growth tissue, but lowest means the newer, not the eldest. So there is a cut off, the eldest tissue is completely lost and not regained, and also the memory with the tissue is also lost. So this muscular tendinous cuff of the shoulder, there is a glenoid cavity, glenoidal labrum, subscapularis, teres minor, capsule of the shoulder joint, infraspinatus and supraspinatus. So like this again, the glenoid cavity, so the yellow part and the glenoid labrum. So this is something like an eye resembling the retina, um, and so then we have the subscapularis, supraspinatus, infraspinatus, teres minor, which are young, still young, and they are not muscles, so they are still tendons, and so they are something like greenish in color. So there is a capsule of the shoulder joint also. Something resembling this emu egg, ostrich egg, which are still white in color but are big eggs. Something like the egg of a five-headed or a two-headed snake. So then we have the subacromion bursa as seen in the sagittal section. So we are having coracoacromial arch and the coracoacromial ligament and the acromion coracoid process. Um, so then we have subacromial bursa, supraspinatus, and glenoid cavity again. So we're having labrum glenoidale and capsule of the shoulder joint. So it's a closer capsule, and so like there is a subacromion bursa along with it. So like usually these bursae are like found in something like the ostrich eggs. So as I said, so then we have the subacromial bursa in the coronal section. So then we have supraspinatus, acromion, deltoid, subacromial bursae, and axillary nerve and posterior circumflex humeral vessel, axillary nerve and the posterior circumflex humeral vessels. And so the dissection is given. So this is the dissection of deltoid, right? So next we have the muscular tendinous cuff of the shoulder or the rotator cuff. So fibrous sheath, four flattened tendons, scapula, lesser greater tubercles, subscapularis, supraspinatus, infraspinatus, and teres minor. So flattened blend with each other, one hand, capsule of the joint, strength except inferiorly, and subacromial bursae, tendon of supraspinatus, greater tuberosity of the humerus, and we have uh, abduction of the arm at the shoulder joint, and it protects the supraspinatus tendon against friction with acromion. Then overhead abduction, greater tuberosity of humerus passes under the acromion. So then we have the clinical anatomy. So the clinical anatomy, intramuscular injections and lower half of the muscle to avoid injury to the axillary nerve. And so deltoid muscle is tested by asking patient to abduct the arm against resistance applied with one hand and feeling for contracting muscle with the other hand. So you need to feel for the contracting muscle with the other hand. You need to abduct the arm against the resistance. So like you can even I usually how I check. So usually in the cadaver, the deltoid muscle looks like feathers. So like it's somewhat like it has a belly, and it can be spread across. Even in a very tough skin or a very lean person, so you just keep your arm on the hand. I mean the keep your hand on the arm, then so like it's given as arm, it's an arm. So keep your hand on the arm, in the middle part of the arm. So you find some resistance, and you could just find the deltoid by palpation, and um, so like contraction is also felt, but in some most of the patient this contraction is not even felt. So like because most of the patient are deceased, so this deltoid injections are given only for flu and fever. So and also for other persons, just feel it and have an injection into. So if don't take above the middle of the arm, such that you just give an insertion into the artery, the main artery. You need to make sure you give it on the left hand of the patient, and so like usually the left hand has some girth, a powerful resistance than the right hand. So there is a present personal resistance. So then we have this subacromial bursitis. So then we have when the arm is abducted, pressure over the same point causes no pain because bursa disappears under the acromion. So this is the Dow-Burns sign. So it is secondary to inflammation of the supraspinatus tendon. So there is pain in the shoulder, abduction, and medial rotation of the arm. So then the tendon of supraspinatus may undergo degeneration. This can give rise to calcification and even spontaneous rupture of the tendon. So usually this tendon and belly. So I think these tendons in the hand can be called as belly, but why the name is as tendon? Just because human beings are evolved from animals, and they can walk in with two limbs only for a certain distance. When you need to move to the mountain, you need to just crawl, and such that. And we have intermuscular spaces. Okay, finish with the deltoid. So there's a huge muscular diagram showing some crane in diagram, and something like a mushroom, a crane. Usually I saw something like this in the Atlantis. So nearby the Atlantic Ocean, and so this is like infraspinatus, the deltoid, and axillary nerve and posterior circumflex humeral vessels in the quadrangular spaces, the radial nerve and profunda brachii vein in the lower triangular space, and we have teres major, circumflex scapular artery in the upper triangular space, long head, lateral head, medial head of triceps brachii, nerve to anconeus, posterior cutaneous nerve of forearm, the scapular region. So then we have the quadrangular space, and exactly I was talking about the quadrangular space of the earth, and there are about some 4 quadrangular space, and so this is something like an alien or an enemy fighting in a diagram. So we need to solve out the puzzle to kill this enemy, and so um, so like I just have some pause video recording so that I could take some break, and so Then it comes a quadrangular space. So this diagram is mesmerizing and beautifully drawn with some nice vegetable oil, I think. So we have this superiorly, we have the boundaries and the medial and the lateral. So let's see the boundaries. It's very important for space also. Subscapularis in front, capsule of the shoulder joint. We have teres minor behind. We have inferiorly teres major, and the contents are axillary nerve, posterior circumflex, humeral vessels. On the medial, we have the long head of the triceps. On the lateral, we have surgical neck of the humerus. So then we have this intermuscular space in the scapular region, including quadrangular, upper triangular, and the lower triangular space. So we have only one more page left for this chapter. So we having a deep branch of transverse cervical artery and suprascapular nerve and artery, supraspinatus, infraspinatus, teres minor, deltoid. So we have teres major also, and we are having circumflex scapular artery in the upper triangular space. We have quadrangular space with axillary nerve and posterior circumflex humeral artery and vein. Then we have radial nerve and profunda brachii artery and vein in the lower triangular space. So in this we are having the upper triangular space and the lower triangular space, and the boundaries are given. So, contents of upper triangular space is circumflex scapular artery. Then the contents of lower triangular space is radial nerve and the profunda brachii vessels. So, we are having the axillary or circumflex nerve next. So, it's a branch of posterior cord of the brachial plexus, and suffix marking is given, root value is given. So we have course and relations. So then we are having the superiorly, inferiorly, medially, and all of that. So there is the nerve to teres minor bears a pseudoganglion. So fibrous tissue and fat with any neurons. Without any neurons. Fibrous tissue and fat without any neurons. So there is a pseudoganglion, and so this ganglions are like some surgical in surgery. There is a term called ganglion. Despite of this, a fatty tissue or something like a fat development underneath the skin. So that's one nice name for it. And so ganglion is similar to that. Instead of fat, there is some nervous endings or some skin or some muscle underneath that. So and so we have branches and distribution: muscular, cutaneous, and articular. Then we have vascular. So in the clinical anatomy, deltoid is paralyzed with the loss of power of abduction up to 90 degree at the shoulder. So the rounded contour of the shoulder is lost and the greater tubercle of humerus becomes prominent. So there is sensory loss over the lower half of the deltoid. So these things are things of some Great Barrier Reef, and so the humerus becomes prominent, and so anastomosis around the scapula. So we have subscapular, supraspinatus, infraspinatus, and occurs in three forces. Um, so there's a diagram given, something like a heart along with the arteries. So a heart with only arteries. So scapula, we can't call it as a heart. So it has wings. So and it's a bone. So there is subclavian artery, thyrocervical trunk, and transverse cervical artery, thoracoacromial artery, acromial process, posterior circumflex humeral artery, axillary artery, circumflex scapular artery, subscapular artery, deep branch of transverse cervical artery, and suprascapular artery. So, so there is anastomosis over the acromion process also. So then we have the clinical anatomy. So there is collateral circulation, can flow to limbs where the distal part of subclavian artery or proximal part of axillary artery is blocked. So and chapter 10, they are asking to refer chapter 10 for other things. So this collateral circulation, it's something like a secondary part. It is a form of disability. And next we'll go to the arm. So like we have finished with cutaneous nerves. So today is 24, 3 and 20. So the arm, so it is also a short chapter, but the forearm and the hand is a big chapter. And the joints of the upper limb also is a big chapter. Okay, then I think it's enough of anatomy. So today is a less anatomical day. So today is a full moon day, I think. So then we'll move on to pharmacology, since it is very affinitive to moon. And thank you, and keep up with all your good works. And hope we meet up soon. And thank you.